Doctors who have given a second opinion diagnosis. What is the worst first opinion you've ever encountered? Well, when I first started feeling sick the October of 1 year at college, I had a non-productive cough, night sweats and trouble sleeping, and I had lost some weight. The school nurse gave me Claritin. All of those symptoms got worse, plus I was incredibly fatigued, my lymph nodes swelled up, and I had pretty bad backaches. My GP took a chest x-ray and prescribed antibiotics for pneumonia. At this point I had almost failed out of school because I was only managing an hour or two of sleep per night. It took until spring break for me to go see a pulmonary specialist. He could instantly tell that it wasn't pneumonia. I had stage 4B Hodgkin's lymphoma. My first PET scan showed cancerous cells and lymph nodes in all 4 quadrants of my body. At this point I had lost about a third of my body weight. The cough, weight loss, and back pain were my swollen lymph nodes pressing on my lungs, stomach, and my back. They gave me my first round of chemo and I genuinely felt incredible. I felt like such crap that an IV mixture of carefully measured toxins was an improvement. I went home and ate a whole pizza. Chemo got shittier but it worked, so I guess I can't complain too much. Glad you're okay. What a horribly frightening experience that must have been. Stay with us, friend. Not me but my mom. She was always exhausted, the type of exhaustion that she'd have a bath, be so tired from it, she'd sleep on the bath mat when she got out. Went to her doctor, told her, "Oh, you're just depressed. Go get a haircut." She did. Still exhausted. Went back to the doctor. Continued to tell her she's just depressed. Get a hobby. It's all in her head, etc. Never sent her for blood work. Never referred her to any specialist. Months later she goes back. Her doctor is on vacation. Physician reliving her doctor takes one look at her eyes and says, "It's your liver. Get these blood tests now." Abnormal blood work and a liver biopsy later. She was told she had autoimmune hepatitis and was 3 months from death. After she improved with medications, she went back to the original doctor and said, "I didn't need a haircut." 27 years later she still suffers from lingering effects. I'm a surgeon. Most patients come to me after having seen another physician who has diagnosed them with something and told the patient to see a surgeon. I've been called to see more than one patient for appendicitis who has already had an appendectomy. I've also been called in multiple cases for patients who very obviously have previously undiscovered, very advanced cancer. It's always too far advanced for me to be of help, so I have to wonder, am I being called so I can be the bad guy and explain everything? Yes. The answer is yes. I have one that happened to me. I did college gymnastics. My senior year I had an accident in practice landing in my neck. Went to the hospital, got x-rays, was told I was perfectly fine. Walked around in pain for a while. Weeks later went to another doc, got a new set of images. My neck was broken in 3 places and had a dislocation. Had a multi-level fusion surgery days later. Found out my X-days got swapped with someone else's in the year and I was originally diagnosed based on someone else's images. This was found out when I went to get my records long after my surgery for insurance purposes and my files had someone else's medical records and images in it. Because of the time I spent walking around with it, I had to have a posterior surgery instead of anterior, which is way more invasive and gives me major issues to this day. I'm a lawyer, but had a client given a devastating diagnosis of an extremely rare heart condition. Doctor told him he had 6 weeks to live. He contacted me to make his will and set his affairs in order. Thankfully, he sought a second opinion with an extremely well-known cardiologist. I guess the cardiologist was intrigued due to the rare nature of this heart condition. There was nothing wrong with him. He was fine. This poor guy and his family were tortured over this, so devastated and terrified. For nothing. He actually called me to tell me all of this. He seemed to be still in the joyous, "I'm not going to die" stage, but I imagine anger comes at some point when you take stock of what you went through. I don't know how a doctor fricks up that massively, or if somehow my client's results were mixed up with someone else's, and some poor bastard's number is almost up and they don't even know it. Not a doctor, My sister was about 2 weeks away from giving birth when she suddenly started feeling excruciating pain and vomiting. I called her midwife, who refused to speak with me despite my sister clearly not capable of speaking, as she sat on the floor next to the toilet, crying and puking. Finally she just took the phone and was told by her midwife that it was probably just a virus and to eat a popsicle. Eventually I was able to convince her to go to the ER. She was immediately rushed in the OR for an emergency C-section. Her placenta had abrupted and my niece was born not breathing, suffered several seizures and even died, and then was resuscitated. She is now 15 and has cerebral palsy due to going so long without the oxygen she needed. Patient. When I was in college I went to the doctor because I was P-raises. It progressed pretty rapidly and by the end of the week I couldn't walk or sleep. The doc asked me about my sex life and I told him the truth, that my girlfriend and I had only been with each other and together for many years. He sorta scoffed at that and told me it was likely chlamydia. Had a long condescending speech about safe sex with me and sent me home. A week later my P tests were back. Turns out I had the worst bladder infection they'd ever seen. I had to have a camera shoved up my pee hole, multiple rounds of antibiotics, and to this day I struggle to pee due to irreversible damage the infection caused. Oh man, that sucks. UTIs are rare in men but super common for women, and I get like one every other year. I've gotten really good at feeling the beginning of one before it gets worse, and I drop everything and rush to urgent care. They hurt. This is the opposite answer, but the best request for a second opinion came from a CVS Minutes clinic. Young healthy law student goes to Minutes clinic. Has the flu. This was a few years ago. No Rona. Feels awful. They check him out. Yup, he has a fever. Aches. Sore throat. It's the flu. Flu swab positive. His clinic vitals were notable for a heart rate of 140. A bit high but not crazy high. Reassuring numbers. 100. The guy otherwise walked into the CVS and is a young healthy guy. Would have been pretty easy to dismiss. Anyway, the Minute clinic says go to the ER. You need an EKG. So the guy follows orders. A chief complaint is I have the flu and CVS told me to come here. Gets an EKG and he's in slow VT, which is a life-threatening arrhythmia that you have to be shocked out of. They take a look at his heart and it was giant and barely moving. He had an insane myocarditis. Dude ended up getting cannulated for ECMO within hours. Cardiac bypass machines as life support. I can't say all Minute clinics are the same, but holy crap, that was a great save. I'm a gynecologist. The number of times I've seen patients pregnant and upset, or happy, because some other doctor told them they can't get pregnant, so they didn't use birth control, is appalling. Usually it's family med. Not ragging on all FM docs, just how it goes. I then have to explain that even if the patient has whatever condition that makes it unlikely for them to get pregnant, the odds are almost never 0%. Maybe 1%, but still not 0. So of course it can happen. Not a doctor, but my mom went into a walk-in clinic and told the doc she had really bad headaches all the time. She was a stay-at-home mom to me, 10, and my sister, 6. So it was written off as stress and got a prescription for pain pills. 2 weeks later the headaches were migraines. Stronger prescription and try to reduce stress. A few weeks go by and she can no longer get out of bed. Throws everything up including the meds, is completely disoriented and barely alive. My dad was a truck driver so he was never home. I was taking care of me, my sister, and my mom all by myself. We go back to the doctor and this lady had the audacity to say this is the weirdest migraine case she's ever seen. Tells her to take warm baths and just keep taking the meds when she throws them up. 2 months go by and my dad came home, saw the condition of my mother, who was so sick she would urinate herself, the house, which was being kept up by a 10-year-old, and said he wanted a divorce. That night we found out she had stage 4 lung and brain cancer with a tumor the size of an egg pressing on her brain as well as many others scattered throughout. I still haven't forgiven that doctor for not taking my mom seriously. I just left a practice partly because a woman brought her 8-month-old in for a second opinion. The practice owner had seen the rapidly enlarging sacral soft tissue mass which the mother first noticed about 6 weeks prior. He told her not to worry about it. I checked his notes, which read, Plan. Ignore. I was shocked. There was a new onset rapidly enlarging blue purple cystic mass on a baby's sacrum. It looked like a small plum under the skin at the top of her bum crack, and without any investigation my colleague dismissed it. I was appalled. The mother was relieved. This wasn't the first not great judgment I'd seen, but it was one of the worst. I realized I couldn't work in a clinic where I'd be stepping on other doctors' toes and couldn't trust their judgment. The babies had her imaging and a referral to a pediatric surgeon, but unfortunately I don't know the outcome because I'm working elsewhere now. Honestly, at that point I'd pull the mother aside in the lobby and say something like, if it doesn't improve on its own in a few days, I'd find a bigger place to give you a third opinion. Told by my doctor my health issues were stress related. The second opinion found my gallbladder was functioning at 3% and had that sucker removed a couple weeks later. What's worse is I specifically asked the first doctor about gallbladder and they assured me it couldn't be that. Gallbladders are notorious for causing a ton of seemingly unrelated health issues. After mine was removed, my life improved dramatically. Not a doctor. My husband had a situation where he almost died because of a misdiagnosis. To preface this, at the time we were young in our mid-20s living in a college town. My husband had horrible pain. On floor, on hands and knees, horrible. We went to the ER and the doctor barely looked at him and just told him to stop drinking and he would be fine. We go home, the pain is getting worse and now he is vomiting. As soon as the doctor's off opens back home where we grew up, we drove 1.5 hours to see our primary care. Within 15 minutes of walking into the GP office, my husband was rushed to emergency surgery. His gallbladder had completely ruptured and he was going septic. It was a total mess and he almost died, all because of a misdiagnosis. Not a doctor. Dealt with an unrelated incident, and reading a patient's notes found he had been diagnosed with a rare but deadly skin cancer and was booked in to have his upper lip removed. Obviously this would leave the patient quite disfigured. On a whim he'd booked in to see a dermatologist at our hospital, who advised it was a cold sore, prescribed Lexiclavir and the problem was resolved. This one astounds me, not only because I'm pretty sure doctors are told not to expect a zebra when they hear hoofbeats, but also because you'd think they would have run a simple test before major surgery. I went to a walk-in clinic because I couldn't swallow anything. The doctor pressed on my forehead and asked if it hurt. I guessed kind of. He told me I had a sinus infection and prescribed me antibiotics that I couldn't swallow and sent me on my way. Turns out I had had a stroke and ended up spending 3 weeks in the hospital. This is the one that really made my eyes bulge. Hope you're well these days. Not a doctor. This happened to my mom like 20 years ago. I believe she was close to 36 at the time and had 6 kids. My mom was having severe abdominal pain, and if my mom admits to being in pain, then you know it's bad. Her family doctor was on vacation and so my dad took her to Emerg. Emerg doc told her she was constipated and sent her home. The pain got worse and so she went back to Emerg a couple days later. She specifically asked the doctor, the same one from the previous time, if it could be an ectopic pregnancy. He laughed at her and sent her home. She ended up in Emerg a 3rd time and got that same stupid doctor who accused her of lying to get drugs. She had to wait a week until her family doctor came back. Just over the phone the family doctor could tell something was wrong and told my mom that she wanted to see her first thing in the morning for tests. Mom didn't make that appointment because during the night her fallopian tube ruptured and my dad found her unconscious on the floor downstairs. He rushed her to the hospital and they found out that she was something like 10 weeks along with an ectopic pregnancy. Our family doctor apparently was screaming at the other doctor in the hallway because of his incompetence. Not a doctor, but I went to a dermatologist for a rash on my hands and face. He insisted it was eczema even though I've never had eczema in my life. He refused to do any testing or take a biopsy. He prescribed me a steroid cream for eczema. The rash spread and got horribly worse. It was all up my arms and all over my face. It was itchy and painful. I went to a different dermatologist and explained the situation. They took a biopsy. It was a bacterial infection and the first doctor essentially gave me a bacterial infection on steroids. I was a minor at the time and I don't know why my parents didn't go after the first doctor. I am late, so this may not get seen, but it's a good story. Not a doctor. My grandmother fell from her horse one day. Not a terrible fall, but from the way she landed. She wanted to get checked out. She felt she'd really jolted her neck spine and was an older lady with fragile bones. Her doctor looked things over, gave her one of those soft neck cushion things and sent her home. A couple days later, she decided to get a second opinion. No real reason. She just hadn't felt listened to by the first guy. The second doctor basically took one look at her x-rays and freaked out. He told her they needed to get her immediately into a brace to immobilize her spine. I googled to try to figure out what it was. I think it is a halo brace, but in my memory it's bigger and more metal than what I was seeing in the pictures. Basically she'd broken her neck, the same injury that had paralyzed Christopher Reeve, but she wasn't paralyzed because the vertebrae hadn't dislocated. The second doctor anything that did dislocate it, another minor fall, twisting wrong in bed, would mean being permanently paralyzed from the neck down. She wore her intense metal brace that kept her spine in place for a few months and was totally fine. She lived another 15 years after that. But I think about that story often. The second doctor saved her mobility and freedom. Obligatory. I am not the doctor but I'm the patient. I went to a sleep doctor because I was constantly tired and falling asleep standing up and such. Serious crap. Doctor was like, well, you're overweight, so it's definitely sleep apnea. I did a sleep study, came back negative for sleep apnea. Doctor was like, well, I'm still positive it's sleep apnea, cause you're a fatty. So he sent me home with a CPAP machine for a month. After a month of using the machine, which records your sleep apnea events every night, and still said I didn't have sleep apnea, and with me having zero improvement in any of my symptoms, I went back to him and he said, well, if this isn't working, I can't help you, because you obviously have sleep apnea since all tubbers have sleep apnea, so you must not be using the CPAP. So I dropped him like a fresh turf and went to get a second opinion. New sleep doc, new sleep study. Come back in and the new doctor's like, yeah, this is textbook narcolepsy. You have all the symptoms and the sleep study proves it beyond a shadow of a doubt. I told him about the other doctor and he said, this is obviously narcolepsy. Your previous doctor was a moron. And, unlike the other quotes in this story, that is an actual, direct quote. I'll never forget the look of disgust on his face when he said the word moron. Also not a doctor. I was diagnosed with MS, sought out a second opinion, and turns out it was an easily solvable vitamin deficiency. Pretty dang different. $15k in medical bills later, only go have all symptoms subside with some nutritional advice and supplements. I'm still salty about it. I had a period of about a year where I was getting constant UTIs, which, apparently, as a woman in her mid-20s is normally caused by not peeing after sex. I'm still not sure what was causing mine, but I was not sexually active at all, due to vaginismus. My doctor was away for school holidays and stupidly, I thought I could last a week until she was back. Nope. 2 days later, I could barely move from the couch in pain. So, I called the doctor. This doctor, a home doctor cause it was a public holiday, refused to hand over the script until I acknowledged that I was being sexually irresponsible. When I said I am a virgin, embarrassing and potentially dangerous statement to make with a strange man in my house while I was home alone, this jackass laughed his butt off and said, no you're not. Nobody is at this age. Stop pretending to be all innocent. Slammed the prescription on my coffee table and walked out, refusing to give me the starter dose that they're required to carry. For people like me, who are alone and can't get the prescription until the first dose kicks in enough to begin helping. Full stop. I called the office to complain and he did get reprimanded, but holy heck was I embarrassed. Not a doctor, but my sister was suffering from headaches and minor seizures for a while. Went to an urgent care and that told us she had an anxiety disorder and just needed something to calm her down. We got a second opinion at the ER and turns out she had stage 4 brain cancer. I miss her every day. Posted about this before but I'll post it again anyway. This is my mom's story, not mine. So my mom used to work at a non-profit clinic that would give free healthcare to people who didn't have insurance. This guy came in with his teenage daughter, basically saying he was between jobs and the insurance for his new job hadn't kicked in yet, but his daughter was having her yearly case of pneumonia and just wanted her antibiotics. He was really arrogant and rude, saying stuff like, She has a Cuban doctor she usually goes to. My mom is Mexican and I live in an area where most Latinos you see are Mexican. My mom, staying calm despite wanting to bite the guy's head off, examined his daughter. She noticed his daughter's fingers were clubbed. Google clubbed versus normal fingers, and this was indicative of a serious, chronic respiratory issue, not something temporary like pneumonia. She asked if she could run a few tests just to be safe, and at first he was huffy about it but was persuaded when my mom told him it wouldn't cost him anything but a bit of time. A few days later, the clinic calls her freaking out because this girl didn't have pneumonia. She had cystic fibrosis. The girl was transferred to a hospital where she could actually start receiving treatment for her condition. It was a minor case. If it was anything more, she honestly could have been dead by that point. But my mom probably prolonged this girl's life expectancy with the diagnosis. Her regular Cuban doctor had been regularly misdiagnosing her with vitamin deficiencies and pneumonia. Later, the father called my mother and thanked her for helping his daughter. My mom was going off in her head. What about her Cuban doctor, how a-hole? But was polite and wished him and his daughter well. TLDR. Not really a second opinion. But when a Cuban guy who was arrogant about being Cuban came in with his daughter thinking she had pneumonia, something she was diagnosed with yearly by her Cuban doctor, my Mexican mother diagnosed her with cystic fibrosis and helped extend her life expectancy. Nurse here. I cared for a woman who had been diagnosed with broken vertebrae. She was in a lot of pain, couldn't get her pain under control, and her blood pressure was very low. She'd lose consciousness and be very difficult to wake. I also couldn't get her doctor to answer the phone, middle of the night. Something just felt off about the whole situation. He finally answered and demanded we Narcan her, insisting we'd overdosed her on narcotics. Following his orders, I then had a hysterical woman in a lot of pain going in and out of consciousness. I finally walked down to the entrance of the hospital and grabbed the cardiologist who came in at 4:30 AM for rounds and said, "This isn't your patient, but I think she's going to die." He came upstairs with me, looked at her and her chart, grabbed the bed and rolled her to ICU himself. I have no idea how the conversation went between the cardiologist and her doctor. She didn't have a broken back. She had an aortic aneurysm, which caused the pain and the low pressure, and the loss of consciousness. She died the next day. Doctors, if the nurse says something is wrong, you might want to lay your eyes on the patient rather than shouting orders through the phone. OMG, that is heartbreaking. Obligatory. I'm not a doctor, but when I had my wisdom teeth out, it was pretty brutal. Like they had to completely put me under, dig deep into my jawbone. The teeth were coming in sideways and upside down, just like the worst case scenario. So, I have the surgery in the next couple of days. I'm in a lot of pain, which happens, and I realize I have this growing hot lump on the side of my jawbone. Me being a dumbass, I tried to be like, oh, it'll go away, but it didn't, and my mom caught sight of it and took me back to the guy who did my surgery. Dentist dude took an x-ray and without even examining it or asking any questions said I was fine and it was probably just scar tissue and told me to leave. I thought, hey, well, he's smarter than me, so I guess he's right. My mother, however, did not think this. And so off we go for a second opinion, and while we're headed over to the other office, the hard lump in my jaw bursts and blood and pus leaks everywhere in my mouth. It was so freaking gross. My mom immediately turned around, drove back to the dental surgeon, dragged me, who was still spitting blood and pus, barged into the office, and made the dental surgeon look in my mouth. The dental surgeon muttered something about hysterical women seeing things that weren't there but prescribed me antibiotics and more pain meds anyway. And that was how the 1-2 week recovery took an entire month, and I ended up having to drop out of a college course due to missing so much. The dental surgeon muttered something about hysterical women. I'm pretty sure this fuckery has caused many deaths. Like many, not a doctor but just screwed over by many. Got an infected hangnail, so I went to urgent care. I got a shot of an antibiotic or a prescription for another. Took the pill for about a week out of the 10-day dose. On that 7-day mark I was in my chemistry class, which was at the end of the day, feeling extremely lightheaded, tired, and so dizzy I could barely see. I staggered down the stairs of my HS to see the nurse, but she was out to lunch. I didn't know what to do and had bad attendance due to chronic illness, so I stayed for the next class. Went home on the bus and passed out on my couch. For the next 2 days I had a bunch of symptoms. I spiked a fever of 104 degrees Fahrenheit, had a swollen lumpy throat, in and out of consciousness, vomiting, coughing, and dizziness so bad I couldn't stand. Went in the next night after coming home from school with a fever of 104. Urgent care doctor said that wasn't a treatable fever, that I had an upper respiratory virus that was also untreatable, and told me to go home and not worry. I wasn't allergic to the antibiotic I was taking because I was taking it for a week and had no reaction before that day. Next night felt even worse. Couldn't keep food down. Could barely breathe. Dizziness was so bad I couldn't get up to use a bathroom without being in severe danger of falling. There was also a rash that was going from behind my ears down to my stomach and little red blotches. Went to the ER this time. Also had a yeast infection from the med. Doctor there wouldn't touch me. He barely wanted to look at me. He wouldn't do any kind of exam on me besides look at the rash on my stomach. He said it was measles. Gave me nothing for that. Said there was no way I was allergic to the antibiotic. Sent me home. Went the next day to see my primary doc who squeezed me in due to my symptoms. Talked to the assistant getting my vitals and symptoms about what was going on. She said I was allergic to the antibiotic. She wrote in my chart that I wasn't supposed to take it. A nurse practitioner came in and listened to me tale of woe. He said I was having a bad reaction and also wrote again that I should stay away from the antibiotic. He said I could have died and usually would have because it built up in my system and caused a deadly reaction. Doc comes in and says the same thing. If I take it again I'll probably die. Not measles. Not an untreatable upper respiratory virus. My dad has a lesion on his leg that wasn't healing. The dermatologist prescribed different antibiotics, pills and ointment, but nothing was working. He did 2 skin grafts that didn't work. This went on for at least 2 years. Then my dad got a new dermatologist from the same hospital. She realized that he never had a biopsy. It took her less than an hour to diagnose the skin cancer. The surgeon scooped all the cancer out, another skin graft, and that was it for a while. Since then he got a lot of other skin cancer lesions but now he knows what it is. Not a doctor but a patient. When I was in labor with my 4th child the doctor refused to admit me. I wasn't very dilated and have a history of fast labors. I know when I'm in labor because the pain is different. He gave me a sleeping pill to take and told me to go home and sleep. I refused to leave. The doctor was angry and said he'd admit me, but wouldn't give me anything to augment my labor. My son was born 2 hours later. Frick you doctor. Listen to moms, we know our bodies. I had the opposite. I'm a midwife and gave a second opinion. The first was received from the woman's GP. She came into the antenatal clinic and said that she'd had a headache that she couldn't seem to shake. She'd called her GP the day before who had told her to take 2 Panadol and have a bath and that she'd be fine. Whenever any pregnant woman complains of a headache, especially one that won't go away, it sends alarm bells ringing as it can be a symptom of preeclampsia. Sure enough, the woman also reported seeing blue spots, had a blood pressure of 220/180 and a huge amount of protein in her urine. I got her to lie on her side in the room I was seeing her in, and raced to get a more senior midwife. It wouldn't have been more than 60 seconds that the 2 of us returned to the room, just in time to see her start having an eclamptic seizure. We called a code pink, obstetric emergency, which then escalated to a code green, alerting theatre that we were coming down now for an emergency cesarean, and the woman gave birth under general anesthetic 20 minutes later. I still start sweating when I imagine what could have happened if she hadn't come into the clinic that day. Doctors of Reddit, who has been your worst? But I looked it up on WebMD patient. I'm not a doctor, but I did take my very elderly nana to the hospital after I showed up to her house and found her slurring her words and behaving very strange overall. Now, my nana is a major hypochondriac and when she was admitted the first thing she told the doctor is that she believed she was experiencing the beginning signs of Parkinson's. It turned out that she had mixed up a bottle of non-alcoholic wine with a bottle of regular wine, had drank the entire bottle, and was completely hammered. Honestly though, the sensation of being drunk would be so disconcerting if you weren't expecting it. Serious answer. I try to ask my patients if they have googled their symptoms. It gives me a lot of information about what they are worried about. I then try to stay humble about their findings, and try to not be a jerk about that. Trust is not built by telling people they are stupid. However, it is hard to keep a straight face when a 50-year-old male walks in and says, "I think I have caught the Down syndrome," or when a young woman thought she had testicular cancer. I actually had pretty advanced serum sickness from strep penicillin and the nurses told me I was not having any problems. The doc in there said he didn't know what it was but looked it up himself and said, "Yup, you do have serum sickness." It felt nice to be listened to. This will make my friend sound stupid, and she really isn't. When she had her first baby and was in that woozy sleepless new mom phase, she took the baby for her checkup and completely misheard when the doctor told her the baby had eczema. She got home and started googling what she thought he had said, and called me in a panic, saying, "The doctor said the baby has emphysema." Why? That infant never smoked a day in her life. This reminds me of when I was getting married and my husband and I were looking for a hotel to stay at on our wedding night. He called me and said he found one that had a honeymoon suite and included in the package was strawberries and shampoo. We still laugh, almost 30 years later, at the thought of toasting our new marriage with shampoo and not champagne. The other day I had a guy come into the ED in tears because he had wrist pain and the nurse at his work's occupational health looked it up and told him he has multiple sclerosis. RN. But my favorite was when a patient's family member rudely insisted we give her mother who had a major stroke, resulting in nearly zero swallowing capability, as much water as she could drink because I read a study online that said you can't aspirate on water because your lungs just absorb it back into your bloodstream. I looked her dead in the eyes and said okay, then explained drowning to me. I had a woman come to see me because of abdominal pain. I spent a good 10-15 minutes of asking her questions to get a better understanding of what could be happening. I ended up ordering an ultrasound to assess for an ovarian cysts and some blood work. As she's leaving she goes, "Are you doing lab work for my prostate?" I had to bite my tongue so as not to laugh and said no, because you're not a male and you don't have one. She just said oh, and left. Spoiler alert, she had an ovarian cyst. Our family doctor once asked my husband if he was pregnant as she went down a checklist. They had a good laugh. Sad and long story, but to keep it very brief, lady on 4 vasopressors including high dose epinephrine was gonna die in the next few hours. Husband was convinced that epinephrine was causing the low blood pressure and low heart rate. He kept going back and forth from home to the hospital with online printouts despite myself, my fellow, and my attending, and the nurses all telling him that this medication is keeping her alive. We looked at his first printout, it said, ephedrine. We're like, first of all, that's not the same medication. Anyways, I actually tell him that if I was him, I'd stay with her and that she may only have minutes left. He's threatening to sue us and he's convinced he's right. He goes home again to get a new printout, and she ends up dying while he's at home. This poor man probably couldn't handle the grief and trauma of this situation. Not a doctor, but when I was in middle school the internet led me to believe that it burned when I peed because I, who had not so much as held a girl's hand, had syphilis. Turned out I was just really dehydrated. Our Hydra homies would like a word with you. I've had a lot of kidney stones over the last 15 years or so, 2 lithotripsies and past at least another 6. I can't even remember anymore, depending on the quality of the health insurance I had at the time and the state of my bank account. Sometimes I would seek treatment and other times I'd just tough it out at home with a heating pad, lots of water and profanity and tears, and whatever pain meds I had, either OTC or prescription left over from the last time. For the last one, a year or so ago, I decided to go to urgent care. The usual doctor. There was this good looking but not too bright fella that my friends and I all called Dr. McDreamy. I knew my body and knew my symptoms, so I basically just wanted an x-ray to confirm and proof of treatments to cover my butt if I needed time off work. Told the doc my symptoms and he ordered a urine test. I obediently peed in the cup and waited. He came back and told me I had a bad UT. I was like, caused by the stone. And he literally rolled his eyes and said, I guess we can get an x-ray. After I got my x-ray, he came back to give me the results. He couldn't look me in the eye as he sheepishly told me I had not 1, but 2 stones this time. I called him Dr. McStupid after that. A mother who was convinced her son had familial Mediterranean fever. He did not. She was repeatedly told this, nicely of course. Yes, the child had had genetic testing by the time I saw the family. Oh, but a small percentage aren't detected by the testing. Thing is, her kid was fine. Healthy kid. Mom was just obsessed with this diagnosis. Not exactly Munchausen by proxy. She never did anything to him to make him sick, or subjected him to a lot of unnecessary procedures. But on that spectrum, she was just a really big fan of Mediterranean fevers. Like a couple people have posted, I've been on the opposite side of this, but I think it still fits. Back when I was a teenager I was a really big fan of human comics, and she posted a sigh about a condition she was recently diagnosed with called polycystic ovary syndrome or PCOS and listed the symptoms. Aside from the ones I couldn't account for like fertility problems, I had nearly all of them. The biggest one being I hadn't had my period in over a year. My parents took me to the doctor who immediately booked me for an ultrasound. Turns out I really did have it and my doctor commended me for coming to him about it. I'm very thankful to Human for posting that SAR. I never would have known otherwise that what I was experiencing wasn't normal. For a stretch towards the end of high school and beginning of college I repeatedly had sinus infections. We're talking one every 3 to 4 months for the span of about 2 years. The nurse I got initially told me not to believe everything I read on the internet and to stop googling my symptoms, just for my doctor to come in about 2 minutes later and say, "So you have another sinus infection," knowing I was going to be right, without her checking. Off topic, but I have a patient right now who has been intubated in the ICU for a couple days after evacuating around 2 L of pus and peeling off hardened pus from her lung, after trying to treat her pneumonia with healing crystals. Sucks. Has a really wonderful family and group of friends. She's slowly getting better though. So this is why you haven't been putting out new albums. I had the reverse happen. I went into my family doctor of 10 years with an extremely itchy arm with a rash. I work with suck animals and told the doctor I was positive that it was either ringworm or scabies. They told me no, definitely not, and prescribed hydrocortisone for contact dermatitis, and sent me back to work with the animals. 3 days later, it has the telltale ring of ringworm and is infected due to the hydrocortisone they prescribed. I went back in and asked why I didn't come sooner. I raged. Not only did I start an epidemic at work since ringworm can be passed between species, and the doctor insisted it was simple skin irritation, but I still have an extremely visible scar known as post-inflammatory hyperpigmentation that can take up to 3 years to fade. My doctor said he could fix it with a $300 skin laser treatment. I found a new doctor. Veterinarian here. This is the worst I ever had, but not because they were wrong. A large lady wearing a muumuu brings a kitten into the clinic. She plops the kitten onto the examination table and says, "Pretty sure it's got ringworm." I examined the kitten, and sure enough, it has a couple of classical ringworm lesions. Too young to give oral antifungals to, so I prescribe a topical therapy for it. Large woman asks if that would work on human skin too. I say it should. She says good, because the reason she knew the kitten had ringworm was because she found a lesion on her own body that she looked up on Google, and it looked like ringworm. And before I can ask anything further, she flops out one large, saggy and obviously non-brassica supported tit through the neck of the muumuu to show me the ringworm lesion on the top of her left boob. Yes, that's a ringworm lesion on your pendulous breast. Now please put it away. Muumuu, appropriate attire for the vet's office. My sister is a paramedic. One day she and a team are sent to house. A man had called about a broken arm. I don't know how he broke his arm the first time, but had read somewhere on the internet that if he just kept breaking his arm then the pain would go away. He had tried around 3 times by jumping up and smashing down his weight on his arm, and it shocked everyone that he proceeded after the first time. In the end the guy had to get 4 surgeries on his arm, but my sister isn't sure if it wasn't eventually amputated or not, since she was pretty sure by the look of it in the x-rays that it would have to be. This is somewhat related, but I'm not a doctor. The only time I self-prescribed was when I thought I had rhabdomyolysis. Never had even heard of it before. I woke up that morning feeling like I'd been in a car accident, had done a very heavy workout 2 days prior, and literally wondered why it was the worst soreness of my life. I didn't start doing any web stuff though until after I went to the bathroom and realized my pee looked like Coca-Cola. What's funny is even going to the I was thinking, this is a total waste of time and I'm going to be laughed at by a doctor today for being a dumbass who looks up crap online. Then I spent the next 5 days in the hospital and went through 70 IV bags before I was finally discharged. I'm sorry this doesn't answer the question, but it's related and I'll say up front. My fiancée is a nurse and she and her nursing colleagues have all agreed I was well within my rights to be the butthole in this scenario. I'm usually extremely polite to everyone, but pain. I went to the emergency department because I couldn't move anything above my waist and was in horrific agony. For no reason whatsoever my back stopped working. This was on Christmas Eve and left it till the 28th to go into Tridge and I'm waiting around for hours. Still in pain and trying to move in any way. Eventually Tridge nurse shows up. So, what's the problem? Back is in agony. Can't move. I haven't injured it. Think it's maybe a slipped disc or trapped nerve or something. I'm not sure. Are you a doctor? You're not, are you? So don't come in here trying to guess what it is. Okay. Are you a doctor? She stormed out without saying a word and the doctor came in 5 minutes later. Took a look and determined some swelling had trapped a nerve. Heavy duty diclofenac and I could have danced 30 minutes later. Yeah, no reason for that nurse to be snarky. She had it coming. As a twist, not a doctor, but I once went into the doctor for what turned out to be a less common skin virus. The doctor took one look and said, "Holy cow, I just read about this on the internet, Christmas tree rash." As a patient who looked up his odd symptoms online, never tell your doctor you looked up your symptoms online. Had odd reduction of feeling in my pinky, ring finger, half my middle finger, along with that half of each hand. Also reduction of feeling from halfway down my thigh and below. Also Elhermet sign. Check for spelling. Saw pretty dead on clues for transverse myelitis. Lesion on the spine. Got sent to a neurologist who basically told me that I was feeling my symptoms because I sketched myself out searching online. Took me and my parents crawling up his butt to get an MRI scheduled. Lo and behold, a nice glaring lesion on my spine. C4 and C5. He told me he would learn to trust his patients more from then on. Hey, I have this. Only it took 2 years and countless doctors for them to even look back at the MRIs they took to go, oh, there is a lesion there. Ha, blah. I hope you've recovered well. I have a spin on this topic. I had a searing pain through the left side of my chest. It was excruciating. It started as a dull pain but quickly felt like my chest was on fire. I thought I might be having a heart attack, but I didn't die and the pain kept building. While lying in bed attempting to sleep and literally crying from pain, I googled my symptoms. My self-diagnosis, shingles. The next morning I went to the doctor and told him what I thought the problem was. To my surprise, he opened a web browser and went into exactly the same site I'd looked at the night before. And sure enough, shingles. I thought I might be having a heart attack, but I didn't die. Me in every situation where I have extreme pain but also do nothing about it. Worst self-diagnosis as a doctor. I was in a rough part of training, not sleeping, working 90+ HR weeks, and losing weight. I crawl into bed after 40 hours awake at the hospital, too tired to eat. I notice my laptop on my lap is twitching. I realize I can feel my abdominal aorta pulsing. I freak out thinking I have an aneurysm. 0 risk factors. Then realize I am hungry and tired and thinner than I have ever been. I sleep like the dead. Not a doctor, but I worked a death scene where a woman was using black salve to treat her skin cancer. Half her face was gone. Her daughter explained that the doctor told her he could remove all of it and gave a really good prognosis, but she was on board the internet's bandwagon and she applied this horribly corrosive crap that doesn't work until the day she died of cancer. You could see her teeth through the hole in her cheek. Her computer was still pulled up to the FB boards where people were telling her it's doing exactly what it's supposed to, just keep to the protocol. It was horrifying. Black salve is literally acid, but it's organic SMH. Check out Miles Power on YouTube. Not a doctor, but when my wife was having some odd symptoms and feelings, she started researching online. All her co-workers told not to do that because WebMD will have you thinking you have cancer. She did have cancer. It took about 7 months of repeated visits to various doctors before someone finally did a CT scan. She had cancer. If you think something is wrong, keep pushing. When her cancer came back, she had to guilt trip her oncologist to do a PET scan because he said it was too soon for it to come back. It was back. So if you know something is wrong, keep pushing until you get the right answers. Oh yeah, happened to a friend. She has a rare form of non-Hodgkin's lymphoma and has for years. Suddenly had weird symptoms for 6 months and then was diagnosed with Hodgkin's lymphoma as well. I always tell her now that with her WebMD is right. It really is cancer. Also, good for your wife to self-advocate. The inability to do that literally kills people. Just graduated medical school a few weeks ago. The most frustrating are the concerned parents who buy into all sorts of myths regarding vaccines. Especially frustrating are the parents who refuse the HPV vaccine for their daughters and sons, not based on any misguided health concerns, but instead due to beliefs that it will encourage their daughters to be sexually promiscuous when they're older. Late to the party, but may as well add this. I was working with a physician and we went to see a patient who insisted that he had tiny fibers and worms bugs coming out from his skin. He had extensively googled his symptoms, self-diagnosed with Morgellons disease, and had even gone as far as to join a support group. He was extremely articulate and intelligent, but when confronted with the fact that Morgellons disease is a delusional parasitosis, he acknowledged this but couldn't grasp that a delusion would mean that he is perceiving something that is not actually there. Delusion equals fixed, false belief. I remember seeing an emergency room show where a building contractor had a fall on a building site and turned up to the OR a week later complaining of a temperature and nausea. He'd broken his ankle and had made a makeshift cast from concrete. The cast was removed to reveal a nasty, red-looking foot. He was recast, placed on antibiotics and sent back home after it looked like everything had settled down. He returned a couple of days later feeling worse with his temp way up, etc. The doc asked him, "Did you sustain any other injuries during your fall that you didn't mention?" To which he answered, "Oh yeah, I cast my side, but nothing serious." The doctor asked to see the wound, and the man removed his shirt revealing a very infected 5 inches cut that had been closed with makeshift copper wire stitches that the patient had applied himself with tools from his building site. I was just astonished when I seen this, lol. Reverse experience. I went to the OR for anaphylaxis, obvious distress, and was made to wait an hour before seeing a doctor because the triage nurse and desk lady didn't feel it was important. Or maybe they thought I googled the symptoms and was able to sustain fake tachypnea, tachycardia, clamminess, and a dusky color. Yeah, I've posted a lot about this. It's a bit traumatizing. I had a patient come into the clinic who insisted she had radiculopathy because her feet were numb and painful, and she wanted a surgical evaluation. I asked her why she felt that way. The only thing she could say was she looked it up on the internet. She was very aggressive about it, saying she needed an MRI and she was mad that her PCP didn't order one. I explained to her what diabetic neuropathy was, and she insisted it wasn't that. I told her that the fact that she had diabetes, the stocking glove pattern, and the fact that at least 2 doctors at her PCP office said this was diabetic neuropathy meant she didn't need further workup for back surgery. She threw a fit. I went to my doctor about a month ago, had a spot on my back end that had me a little worried. Marizo, since my mother had skin cancer on her hinny. I had also recently been around someone who has shingles. Prior to this, I had pain in my foot and went online and found it to be plantar fasciitis. When I saw my doctor later that day, I told her what I found on the internet and she said, "Yep, that's exactly what it is." Now, I joke when I am nervous and I was plenty nervous due to the incidence of melanoma in the family. So when I went in to see her about my spot, I told her that I had been on the internet and I was pretty sure I found out what it was that I had. She asked me to elaborate and I told her that I was pretty certain I had shingles cancer. She just about fell out of her chair laughing. One time I accompanied my wife to the doctor's office. She had looked up her symptoms on the internet and diagnosed her calf pain, a strained muscle in hindsight, as peripheral artery disease. The doctor was not in the least sympathetic or tactful in explaining that pad doesn't appear suddenly during an exercise session. She felt humiliated and immediately changed to a more sympathetic doctor. 20 years on, the self-diagnosis errors continue. This is kind of the opposite, but still amusing in a sad, George Carlin was right kind of way. I was poor, but also a responsible adult, so I was at the free clinic down the block from my work for a routine exam. In walks an acquaintance with a woman who was clearly her friend, but unknown to me. They come over and we make introductions. The acquaintance's friend is called shortly before I am. After the usual song and dance, I head back out. I see the acquaintance, now alone, and go to chat a bit more. She explains that her friend was sure she had a UTI, but it turned out to be gonorrhea. She was back asking how long she'd had it, and trying her damnedest to work out where it came from since her long-term boyfriend couldn't possibly be the source because he would never cheat on her after the last time. I ask who the BF is, and it's a sleazerbag in a band that was trying to try it on with me a few months back, but I was not into him. I had no idea he had a GF, or I would have given her a heads up. Here she was, adamant that she must have had gonorrhea for several years but her immune system suppressed it until she recently got stressed out. I told the acquaintance about his not so distant attempts at cheating with me, so she could maybe get the woman to see reason. I thought it would be better coming from a friend rather than a stranger. I learned later that the poor woman had gotten the nickname Mrs. Picklesworth after getting drunk at a party and masturbating with a pickle in front of a dozen or so partygoers before eating said pickle. So I mean, I can understand the UT assumption, but not believing medical professionals over a serial cheater really burgled my brain. Rewind to 3 or so years ago. Co-worker started missing periods, gaining weight, mostly around the stomach area, sick most mornings. Another co-worker provided pregnancy tests. All came back positive. A trip to her alternative practitioner left her diagnosed with a borderline celiac gluten intolerance disorder. Ate egg and bacon sandwiches for breakfast every shift but refused to touch flour. 75% of her job at the time, as it absorbed through her skin and made her bloated, sick and irritable. Left work early one day with kidney stones. Left the kidney stones on her toilet floor to die where paramedics later revived him and DHS got involved. She is never allowed custody of her kidney stones. Has mentioned several times about suing the local clinic for not telling her she was pregnant. The same clinic my GF gets told to pee in a jar every time she has so much as a sore throat. TLDR. Co-worker was pregnant. Told so by everyone. Denied it and found a charlatan that gave her alternative advice. Now wants to sue for not being told she was pregnant. What would be a funny thing to say to a surgeon before anesthesia kicks in 5 seconds later? I had broken my wrist and was being put under to have 4 pins inserted. They gave me my anesthesia through a knife. I felt coldness spreading up my arm and across my chest. The nurse asked how I was doing and I said this must be what dying feels like. I heard her say oh my god, then I was out. Bro, I actually have a relevant story that happened recently. As I was getting ready to go under, they were placing a device in my mouth to keep me from biting down on the scope they were going to use for the endoscopy. Think medical ball gag, but a hard plastic ring instead of a ball. As the gal was placing it and I asked, wait, what's the safe word? I heard a good amount of laughing as the world turned to black. This is amazing. Related comment but doesn't really answer the question. My dad was in the middle of a surgery repairing some pretty nasty damage on his wrist after a skiing accident. He was under heavy anesthesia but the surgeons were having serious trouble with the screws in his wrist, which apparently jarred him around enough to wake up. He noticed their struggles and managed to say righty tighty, lefty loosey, then he passed back out. I'm told that when I was out having one of my fingers patched up and another reattached after a table saw accident, I asked the surgeon if the drill he was using to put screws in my hand was a DeWalt or a Ryobi. Once a tool man, always a tool man. I had just woken up after having my shoulder worked on. I was in and out of consciousness for a bit and just generally freaking whacked out. I guess I shifted in the bed and moved the blankets a bit and exposed myself as the nurse came in. She smiled and moved the blankets back. I apparently told the nurse, you saw mine. Do I get to see yours? My wife was in the chair next to the bed. I remember thinking the nurse was smoking hot. I woke up and she told me she was flattered. I have no idea what I said. Before going under for wisdom teeth, the doctors said I might feel funny. They pushed the drugs and asked if I felt any different. My butthole, and only my butthole, began to itch like crazy, and it was hot, not warm. Hot like I just ate peppers with my butt. I told them my butthole is itching like crazy. The assistant was really bad at holding back a laugh. The doc resisted mightily, but he too succumbed to my newly discovered butthole emotions. They actually gave me some kind of drug that had the exact same effect when I had surgery. They warned me prior, though, and I kind of laughed it off until it actually happened. As the anesthesiologist was putting me under, he just said I'd start to feel sleepy soon. I asked him, aren't I supposed to be counting back from 100 or something? He replied, I don't know, I must have skipped that class. Being an anesthesiologist must be awesome as you can always get the last word in. I was being put under for a wisdom tooth extraction a few years back, and it was the first time I've ever had anesthesia. They used injection method rather than gas, so they told me to watch the fluids going in so I could gauge when I'd feel sleepy. I had this idea that I would say something like, oh no, doc, I've lost my eyesight, or something else preposterous. Before I could collect my thoughts, I just immediately blurted Welsh. My voice progressively getting lower, and passed out. Last time I went under, as I started to fade, I said, you're gonna have to drive. I'm fricked up. Probably came out, you're gonna have a drive. I'm fucked up. Method acting. I like it. Waking from anesthesia one time, I heard someone say his blood pressure is a little high, then I mumbled that'd be the anesthetist assistant's fault. They then kinda startled, asked quickly why is that, becoming slightly more coherent I continued with she's really hot. They all laughed and said he'll be fine and released from theater. So after my dad had a triple bypass and was just waking up and they had removed the breathing tube, I was in the room with him. I said something along the lines of everything went perfect with your surgery, dad. No problems. My dad in his drug haze said that is because I am a perfect specimen of the human male. And it couldn't have gone any other way. Nurses were cracking up. When I got my wisdom teeth removed. Doctor, alright, so you feeling that sedative yet? Me, yeah, a little bit. I bet I can stay awake though. How long can people usually fight it? Doctor, not long. Good night. Me, blackout. I remember laughing when I woke up because that was the last thing I remember. My surgeon told me to think of a happy place. Then he asked me where it was. The Simpsons kicked in, and I told him it was the happiest place on earth. Tijuana. I didn't stay awake long enough to see if he got the reference. Tahiti. It's a magical place. I had to get some surgery that involved cutting open my head. Right before they gassed me, I said, I should warn you, there's a spooky skeleton in there. The last thing I remember is his response of I'll try to look out for that. Doot doot. When I got my wisdom teeth out, the dentist's office was right next to a funeral home. I told the guy that if anything went horribly wrong, they could just take me next door. Mother and doctor were not amused. Just throw me in the trash. As they were pushing the drugs, they asked me to count backwards from 10. All I could say was, no. The room erupted in laughter and I was out. Freaking make me, doc. I had to have a pilonidal cyst removed from my butt crack and can remember giggling like a madman because I asked the entire operating room, so, who drew the short straw and has to shave my butt? When I had my wisdom teeth removed and was given general anesthetic, I apparently said if this is what being on drugs is like, sign me up. He went and told on me to my mother. I actually did the same thing for both of mine. I managed to get out. I'll see you in the future, doc. Or something. Either way, once the drugs kicked in I didn't care. That's heavy. I asked for a tummy tuck while being wheeled in for a bowel resection. I said while you're cutting it open, just cut some off. Then when I was done my surgery, but still pretty messed up on drugs, I asked if I was skinny and then cried when my doctor told me he didn't give me a tummy tuck. Same doctor, different procedure, terribly inappropriate joke. Had to have a colonoscopy, so they gave me some medication where I was awake, but like, it was weird. Anyways, I was feeling silly and told him first time doing anal on camera, and I'm not even getting paid. I asked for a tummy tuck after both of my C-sections. Doc gave me the same answer each time. I make it work. I don't make it pretty. Right before I went under to have surgery on my septum, I was about to start counting backwards before they put the mask on. Does anyone need anything while I'm out? The last thing I remember was an all room full of people hysterically laughing. I'm gonna need to get surgery so I can use this. The other way around. I was cracking jokes with the nurses and anesthesiologist before a big surgery and everyone was laughing. Anesthesiologist turns to me and says, "Well, it's not fair that you're the only one not on anything," and then hit me with anesthesia and I was out. I said to my doctor during my wisdom teeth extraction, "Doc, don't start, I'm still awake," to which he said, "We're already done. Those drugs are legit." For the record, my wife does not like it in the butt, because I said this before my surgery. My wife is a nurse who works at the hospital I was in. I don't remember saying this, but her co-workers remember it. I told them that I hadn't pooped this morning and that if I crap on them, it's their fault for scheduling the surgery at 6 AM. Then I passed out. Last time I went under, started to feel a sort of paralysis and couldn't move. Me. Whoa. Did you give me something? Nurse. Yes. Relax and don't fight it. Me. Okay, but you should sell this stuff in the gift shop. Everybody laughs. Surgeon. Are you okay? Me. Yeah, but I'm disappointed there's no cake. Surgeon. Laughing. On the recovery notes, right, give the patient cake. Next thing I know, I'm waking up in recovery with a slice of chocolate cake on the table next to me. Cake is a favorable alternative to death. My wife went to the dentist last weekend. After several shots of numbing, she sang to him, "I can't feel my face when I'm with you." To the dentist's credit, without batting an eyelid, he replied in full voice, "'Cause I numbed it." You mean last weekend? When my appendix burst, I was being wheeled in, and as the doc was getting ready and I was about to pass out, he said, "Geez, this is rusty," and held up a scalpel. I could tell he was joking and off I went to sleep. When I woke up, he came to check on me and the first thing he said was, "Have you seen my watch?" I crap you not. He was a very funny man and it really helped calm me down in a situation where I nearly died. Okay, so I know this is late in the thread, but when I was 15, I discovered that I could pull my foreskin back behind my penis head. Needless to say, my foreskin was so tight I opted for circumcision. My doctor, Dr. Lentz, was the funniest dude I've ever met. Told me my dong was gonna look like Frankenpenis for a month or two, but it's cool. Anyways, I am in the OR on Christmas Eve and I feel the anesthesia starting to kick in, and before Dr. Lentz walks out, I shout, "Slur doc, please, just take care of the little guy," and he stops, turns around, bows to me and says, as if he were my own. I laughed once, then passed out. I was being wheeled into emergency abdominal surgery once and my girlfriend was with me. We're rolling down the hall and they have the mask out to put me under, and I pause and say to her, "Don't let them touch my dong." The nurse smirked a little and they put the mask on me. In somewhat of a panicked fashion, I pulled the mask off, stared up at my girlfriend, and with full weight and seriousness told her they can look at it, but no touching. I heard the doctor laughing as the gas kicked in. This is particularly funny because they most certainly did touch your dong. With long surgeries under general anesthetic, you need a catheter so you don't leak all over the sterile field. Sorry. Similar, I had some kidney stones, and they had to go up there to unblock my parts, if you know what I mean. As I was waking up from anesthesia, I apparently asked how many people saw my PP. A few minutes later, as I was a little more coherent, I asked the nurse what's the craziest thing she heard from someone waking up from anesthesia. Her answer, "How many people saw my PP. Good times." I just went under this past week. I told my doctor I better not wake up with any dongs drawn on my face. The room had a laugh. I went to sleep, and they performed the worst magic trick ever and made a camera disappear up my butt. I remember being a celeb at a hospital after I said I love my girlfriend cause she got big titties. When I'd go in, I'd have doctors and nurses teasing me. I was 16 at the time. A couple of years ago while I was being prepped for bone surgery, I had good rapport with the anesthesiologist. My dad is one, and we kept talking about pain management and such. He pushed the dose of ketamine and propofol into my eye and my brain was getting foggy. I remember seeing him laughing his butt off as I went to sleep. When I woke up, my friend who was attending the surgery told me that while I was dosing off, I told the surgeon this is the very first time I tried ketamine unrecreationally. As I was going under for gallbladder removal, at the time 25-year male, the surgeon said, "Now you're not 40 fat frumpy and female, are you? The most common demographic for gallstones." I replied, "No, and I better not be when I wake up." They laughed so hard they had to put their tools down, and then he cut me. The anesthesiologist and all staff were not amused when I said frick this crap, ripped out my IV, rolled off of the table and collapsed on the floor. Before sedation, I was angry about the poor and uncomfortable placement of my IV. When the happy juice started flowing, my inhibitions disappeared. I didn't remember any of it, but the IV being in the other arm was the first thing I noticed when I woke up after surgery. Here's one that actually happened. My grandmother's sister was getting an epidural done for one of her children. When she came to, everybody involved couldn't stop giggling around her, and she had no idea why, until it comes out later that while she was doped, she had repeated one of my great-grandfather's favorite problems of logic. If you're shoved up to your neck backward up a sheep's butt, and there's a bear coming to eat ya, what do I do? Do you pull your head in, or bite the sheep's butt to make it run faster? It's a shame he died before I was born. That man. This is kind of relevant, but I recently had ankle surgery, and just after waking up I looked at everyone and said, "Already finished?" That was quick and they all looked at me with extremely annoyed looks on their faces, and the surgeon said that took us 4 hours. Anesthetic is scary. When you wake up you haven't felt the time pass. People say being put to sleep, but it's more like being out of existence for a while. Here's my impression of my wife during sex. Doctor, not with me. The last time I tried to say something funny right before surgery, they were about to put me out and I said, "Go easy on me, doc. It's my first time." I gave a little chuckle and so did the doctor. He then picked up a scalpel and said, "Don't worry, it's my first time too." And then I promptly blacked out. Surgeon's assistant here. I have, on many occasions, right as people are falling asleep, said, "Quick, don't think about dragons eating you. No, don't do it. Their eyes get so big," and then out. He told me to get a gold watch to fix my watch rash. I told him we can't all be rich fricks like you. Or rather, we can all be rich if you lick you. They all got a good laugh as I passed out. I want my baby back, baby back, baby back. I want my baby back, baby back, baby back. Then the surgeon will be all pee the whole time because you never finished it. As soon as you wake up, try and muster re-ibs, chilies. Another version. I see you shiver with antisy, and when you wake up, passion. The last time I had surgery was July of 2012. They asked me to count backwards from 10, and I did. Got all the way to 0. I kind of just stared at them. Someone asked me how school was going. All I remember was me saying it's summer and someone else responding with, "Yeah, Michelle, it's summer." I've never wanted to say anything, but because I'm usually getting a colonoscopy, I've always wanted to have a message on my butt for after I'm already under. Ideas have ranged from simple things like "Stop looking at my butt" in Sharpie, to getting someone to do Michelangelo's creation of man on my butt, with God and Adam both pointing at my butthole. If I die on the table, I'm coming back to haunt you, mother. Unfortunately, it turns out I cannot control my volume when the drugs are starting to kick in, so I shouted that at the top of my lungs across a crowded pre-op room. Scared the heck out of the other patients. For everyone there, I'm sure that funny situation was instead a total shitshow. For me, however, that funny situation became freaking hilarious upon revealing that you screamed it. If I don't make it, tell my wife and kids that I wish I could have been a better father and that I will always love them. Me at 13 before getting circumcised. Doctors of Reddit, what's the best asking for a friend story you've heard? One girl was interested in laxatives for a friend. She tried to learn everything about the dose, where what to buy, how to drink, She was brought in a week later with complete intestinal atony. She tried to lose weight so much and drank 2 or 3 tablets at a time. Oh, I have more stories like that, lol. I asked my doctor about AA for a friend of mine. Really? Years later the doctor still asks me how I'm doing with my sobriety. I've stopped trying to convince him I really was asking for a friend. A doc had a guy who just got out of jail a few days earlier came in with his GF who had signed in for an STD check. Walk in to meet them and he says casually, is it possible to get gonorrhea in your throat? At that moment I knew he had gonorrhea in his throat. Not a doctor but public health worker, kinda NSW, had an older man come into our clinic asking for a specific type of STD check. Guy's ex-wife was going around telling rumors that he was having sex with his goats, so was wanting to know if there was a way we could do a STD test that could prove if he hadn't had sex with any goats. Through this whole conversation, he just abruptly asks, so if someone was having sex with a goat, what STDs could they get? That dude is totally freaking his goats. Doesn't sound like a rumor to me. Not a doctor but pharmacist. Someone called the pharmacy one day, a young guy. I picked up, excuse me, how much does Viagra cost? Is there anything cheaper? I have someone that needs it. I explain everything and suddenly, will it work if I take it with alcohol? The guy began asking for someone else. At the end was for him and was asking just because he wanted his little one to work while drunk. Not mine but one of the older pharmacists I work with went out to help this 20-ish girl with some med questions. She then asked him about condoms and said, if you were to do me, what condom would you use? Yeah. He just walked away. All 12 of them, at the same time. My father is a doctor and he got a call once in the middle of the night from his call shared doctor's patient. The man asked what to do about a bump on his friend's arm that he scratched and something came out. He mentioned it was leaking a little oil now. It was as it. He scratched a pimple. Woke the whole family up at 3 AM because he had to page my dad over as it. How old was this man? Wife's dad is a urologist. When we first started dating, a friend of mine wanted her to ask if any of the penis enlargement pills were legit and actually worked. She went with the asking for a friend approach and he immediately assumed she was talking about me. Thanks babe. I briefly dated a doctor and she told me a few hilarious stories. 1. If my friend masturbated with someone else's vibrator, will she get an STD? 2. Can wearing a butt plug all day give you diarrhea? 3. If you have an ulcer and swallow a guy's CM, can you get pregnant? 2 out of 3 of these seem like somewhat legitimate questions. Lady walks in and goes, so if you cheated and got pregnant, but then had sex with your husband with a baby become his? It took everything in me not to laugh. Haha, I would have crapped myself laughing. Not a doctor, but I was an intern. I was in the OPD and this man from a different province came in and told me his friend has injected petroleum jelly in their member years ago and that now it's getting painful. Why yeah. He came back the next day and showed his lumpy member. This is a common thing apparently. Saw a patient who did the same, had to have his penis reconstructed. He told everyone it was worth it. I doctor here. Finally closed our offices to all but emergency care. Last year or so I had a staff member ask me for a friend if she got shot in the eye with CM and is now getting mild discharge. Is that okay? I looked at her eye and saw discharge. Went to the cabinet, gave a bottle of antibiotic to her for her friend and then went back to my patients. 2 days later I look at her and say, your eye is looking much better today. She says thanks. The discharge stopped a half day after using the drops. Not a doctor, but I used to work next to AA pharmacy and my boss, a 55-year-old man, asked me to go buy him some condoms for his nephew. Alcoholics Anonymous Pharmacy. Studies have been done about the effects of THC on glaucoma. When I worked for a glaucoma specialist, we had a hippie type person come in with their family member for a new patient eval and ask the doctor to sign paperwork okaying a medical marijuana script for the patient's glaucoma. Problem was the patient was totally fine, didn't find any signs of the disease and his eye pressure was within normal limits, and the doctor did not appreciate having someone try to trick him. To piggyback off of this, and because I'm tired of the questions, marijuana only lowers your eye pressures for max 4 hours. To have sustained effects you'd need to hit the blunt 6x a day and nearly 2,200 times a year. Take the dang eye drops. Another family medicine doc called in a doc yesterday on the cell phone asking what to do when you get soap in your eyes. Choose wisely, folks. I mean, it says so on the bottle. In case of contact with eyes, rinse thoroughly and contact a medical professional. Better safe than sorry. One of my besties called me late at night after his day party. He said someone who was staying the night wanted to have sex with his GF. They were drunk and a little uncoordinated, and somehow the frenulum, the little string thingy at the tip of the penis, ripped, and it won't stop bleeding. I gave his friend some general advice on stopping the bleeding and recommended a trip to the ER. The next day he asked me if I had any recommendations for urologists for his friend, because he needs minor surgery on his PP. I told him to cut the balls, and in response he sent me a pic of his injured penis. So, long story short, his wang got a remodeling and he is still with this vagina dentata sporting woman. I like that the friend was having sex with his girlfriend and he was still supportive enough to ask advice for the friend. There is one dream where in my dream, I'm Spider-Man, but I'm losing my powers. I'm climbing a wall but I keep falling. In my dream. Actually, it's not even my dream. It's a friend of mine's dream. You know, I'm something of a doctor myself. Not a doctor, but I saw this dude say to a doctor, "Can two white people have a black child?" asking for a friend. The man's wife had an affair. That's rough. He must have had so many emotions running through his head. I wonder if the guy ever suspected anything before his wife gave birth. Yes, hi, this is Dr. X. I need to call in a prescription for hydroxychloroquine. Do you have any in stock? Asking for a friend. Divorced women cougars like to explain muscle strains as sex injuries to get a rise out of docs. Best way to deal is to stay monotone and not react. Patient describes proximal adductor muscle pain in hip flexion during recreational activity. Rated 7/10. Pain is now present during ambulation. If you don't react, they move along. Doesn't take long in the office to have seen and or heard everything. I'm not interested that you are recently divorced, started working out, and discovered Tinder. Good on you, but it takes more to get a rise out of me. One colleague in training had a professional cuddler with a similar injury. Doc was very conservative, possibly on the sheltered side, and in front of two of his superiors during the case, and she was not shy. I would add she was not visually what I assume most would hope for in a professional cuddler either. That one I enjoyed, on account of him, not her. Not a doctor. Heard this one from my cousin. A guy comes in and asks if it's possible to get a girl pregnant with someone else's sperm if guy A had sex with guy B before banging C female. Wish I knew the full story. Can't be sure, but my guess is that guy A had sex with guy B before banging C female. Not a doctor, but was mistaken for one by a drunk dude at a costume party once. Okay, twice. Sent him to sober up the first time, comes back 5 minutes later with no recollection of our first conversation and asks me for painkillers, and at which dose they kill you. I gave him the number for the suicide prevention hotline on a napkin and told him that they can help with the issue. He happily staggered away and I haven't heard from him since. Either he got help, or he didn't, but either way, it was a weird experience. So not me, but a person I saw. So the patient, sick as heck, staggers to the doctor and at the absolute loudest possible voice she said, "Are you single?" Betty wants to know. Betty was her childhood pet cow. The doctor calmly says, "I'm sorry, but I am not interested." We were all busting out laughing and I barely could breathe. I later asked the doctor how he kept a straight face. He said, "Laughing on the inside. It's a lot like crying on the inside." That is now the hospital I frequently visit. General practitioner here. One of my non-medical friends asks me that his friend wants to know a good home remedy for an STD. I told him a tablespoon of powdered detergent mixed in 1 glass of water should work. Next thing I know, he's in my kitchen stirring a glass. Asking for my puppy. I took a class in medical parasitology. The professor, a PhD in parasitology, once had a very concerned neighbor bring him dog poop that had human pinworms in it. He suggested the neighbor take his puppy to the veterinarian for some albendazole and assured him that the infection would resolve. Pinworms are still a common and very treatable infection, even among first world children, but not puppies. I'm directly related to a nurse. More than once I've approached her with a question for a friend that actually was for a friend. Middle-aged women ordering a shitload of comfort food at our KFC drive-thru and then adding, sometimes multiple times, that it's not just for her. It's usually the contrary that happens to me when I get food delivered and discover that they put cutlery for two in the bag. Nope, nope, nope. Everything's just for me. Not a doctor, but a friend told me she asked her Gino if it was possible to hurt your stomach from swallowing too much jizz. When I was in med school, one of my classmates, who was always a bit unfocused, asked a psychiatry professor during a lecture if there was any research about cannabis and other drugs going on at our university, in case that group needed another PhD student. This classmate didn't graduate, as far as I know. I met him a while ago, and he looked like a stereotypical hippie. Looked past me, not at me, and didn't recognize me even though we were in the same case group a bunch of times. Seems like he found his own way of researching drugs. Well, one time had a guy say what happens when you stick a tapeworm up your penis, and then he immediately followed with I'm asking for a friend. My thing was he was squirming a lot, so I had already assumed he was lying, so I told him he should go to the hospital to get it checked out, but I don't know if he did. It was very strange. Not necessarily asking for a friend, but my mom worked for a doctor in my hometown. He was a foreigner. I needed to see him one day and he begins telling me that not him, but his foreign French friends think Americans are stupid, lazy, fat etc etc. But he was saying it with a lot of oomph behind it, like he was disgusted. My cousin is always telling this story to my sister when she's drunk. The girl who came in asking if her friend washes his condoms after sex and reuses them, would they still be able to work? After a week, the same girl comes in to ask my cousin to tell her boyfriend that the kid was his. Apparently this friend she was asking about was her boyfriend's close friend who she cheated with, and he got her pregnant after reusing condoms more than a few times to save money. Won't be saving money for condoms anymore, that's for sure. I just can't imagine being that cheap. Even if you need a special brand, it would have been less expensive than a paternity test or a baby. This person had legit medical questions but was too afraid to ask, so he created our AskReddit post hoping someone posted a similar question. In June of last year, a man who came in to me about an ingrown toenail asked me if, hypothetical, you put a Skittle up the hole of your penis, will it dissolve over time if it won't come back out? Asking for a friend. He says it doesn't hurt, it's just kind of uncomfortable when he gets a boner. I was part of a tattoo removal study. I asked the doctor what was the worst tattoo she ever saw. She said that there were some really bad ones, but the one that stuck in her head was the burly biker that got a no regret tramp stamp in flamboyant calligraphy. She said she almost asked if it was consensual. Can putting a catfish in your rectum cause internal bleeding? Asking for a friend. And I didn't believe him until his friend came in and had 7 scars on his face just from trying to catch a knife while laying down. The reason I didn't believe my patient was asking for a friend was because he came into the hospital with an injury from falling off the roof while riding a skateboard inside a shopping cart. Not a doctor, but a patient. It was my first gyno appointment and the doctor was convinced that I wasn't a virgin, even added sorry. I just didn't try to correct him. Still a virgin. I wouldn't be seeing that doctor again. So inappropriate. One of my grandparents wasn't a nurse for like 30 years. She once had a young girl, like 18 or 19, come in asking for a friend of hers if she could still get pregnant if he used a condom but left the condom inside her afterwards. Surgeons of Reddit, what has been your biggest oh crap moment? Way back in the day, pre-op was done with alcohol-based cleaners. Naked, sedated guy with a light sheen of cleaning fluid on him and static electric spark equals fully engulfed in flames. Everyone just stood there for a second till someone grabbed a sheet and put out the flames. Surgery went well, no complications, slight suntan. Balboa Navy Medical Center, San Diego, old surgeon. This one's from my dad. We were putting up a central line for a drip with an 18G needle, 1.2 mm relatively big compared to most needles, in the patient's external jugular, and all of a sudden the needle went right into the jugular. We all started panicking because usually with a drip the needle is meant to come out and only the plastic remains. But now we had lost the needle inside this guy's jugular. Before we could even fish it out, it was gone. I looked at the fellow surgeons and nurses, and before we could do anything we rushed him right into theater. After a few minutes we fished the needle out near his subclavian vein closer towards the shoulder, and we breathed a sigh of relief. Oh god. I wasn't present for this, but I got to deal with the fallout. Client brings his cat, found as a stray, to be spayed. The vet, my boss, preps cat for surgery and begins cutting, and can't find the uterus or ovaries. Oh, cat is a male, and poor kitty just had his belly sliced open for no reason whatsoever. The owner was, understandably, furious. I was a junior doctor working in neurosurgery back in 2008 when one of the senior registrars, I suppose the equivalent is chief resident in the USA, told me his most unfortunate moment. In order to have a patient's head stabilized for surgery, he was using a frame that had a set of 3 spikes that held the head in place. Due to the angle he needed to approach from, this required the patient to be face down. As he was placing the head of the anesthetized patient onto the frame, the head slipped and his eye landed onto the spike, perforating the eyeball. Panicking and thinking that his career was now over, he then, rather busily, started poking at the eyeball trying to work out what was what until the anesthetist told him to stop. They then called the ophthalmologist, who came to tidy up what was now a completely ruined eye. After the surgery, terrified, he went to explain to the patient what had happened. Understandably fearing the worst, anger, distress and tears, received the response of "That's okay, I was blind in that eye anyway. Luckiest bastard ever." TLDR. Surgeon perforates patient's eye by mistake. Patient doesn't care. No freaking way. I woke up during the last part of my gallbladder removal. I felt this pressure, as my surgeon had him for a prior operation. Funny guy was trying to close one of the wounds. I lifted my head. We locked eyes and he had this startled "oh frick" look. Then he snapped back to normal, said "patient's up," and the anesthetist was on that crap. Woke up an hour later in recovery. Props on both of them for sure for handling it properly. Anesthesiology is an inexact science and mistakes happen. Hopefully it didn't frick with you too bad. I'd probably crap all over the table in fear. Had a friend with a swollen area on his lower back where it got to the point where he could barely sit. So he goes to his family doctor. The doc says, "Yay, that's a pilonidal cyst. We should probably go ahead and take care of that." He told my friend to take off his shirt and lay flat on his stomach. So he's laying there and waiting, and the doctor says, "You're going to feel a poke," and is at this point expecting a local. Well, first it turns out the poke was actually a scalpel, not a local. He said it basically felt like someone took a fire hot poker and drove it into his back. He then hears the doctor exclaim, "Oh boy, we have a pumper," just as he feels warm blood and pus now pouring all over his back. The nurse's face, which was the only thing he could see, went from a warm smile to what he termed as pure and unadulterated fear, as the doctor is screaming for her to get gauze and towels. The doctor climbed up and laid on his back to apply pressure for about 10 minutes until the bleeding stopped. So yay, I'm hoping I never get one of those. Worked in an OR for a couple years as a biomedical engineer. Sprinted to the room when equipment wasn't working right, or, more often, the surgeon or anesthesiologist didn't know how to use the equipment. This happened so much. With about 70 ORs, this was a fun day. 1. A surgical table was malfunctioning going into full Trendelberg. Table tilts to a serious angle, was tilting on its own and patient was sliding off the table. The whole surgical team was holding onto the patient as I run in. The fix was I slammed the controller against the floor a few times. Patient was okay, but blood everywhere. 2. A resident was putting in a trocher and misplaced it. Sliced open the aorta. 12 hours of surgery to repair. She was going in for a simple procedure. 3. Surgical robot froze in a case. Had to reboot, but the arm was grasping a main blood vessel. So we didn't want to reboot for fear the arms would rehome and let go of the vessel. Also, we lost video when it froze, so we couldn't just retract the instruments. Lots of people saying oh crap. I am the one pushing the power switch, so if it tears out someone's organs they all look at me. 4. Brain surgery. Microscope video feed crashed. I was trying different video connections to get the overhead monitors back up, but every time I accidentally hit the scope with my hand, causing vibrations that were pretty magnified while working in the brain. He told me to never mind and to get the frick out. This was my first day, so it's okay. Many more. Wars are a scary place, but fun and exciting job for sure. Rewarding to save the day while a team of surgeons, nurses, PAs all thanking you profusely. I will never, ever go to a doctor again. Ever. Not quite a surgeon, but somewhat medical. I was bisecting someone's leg, deceased, and I did not know that said person had a metal rod through their femur. Proceed to cut through the bone with a metal saw. Sparks fly and my blade broke. Luckily I was standing off to the side, instead of directly behind the bleed, as it flew backwards and hit the wall. The clothes the person had been wearing were lying underneath the body and caught a spark. I doused it with the water hose before a large flame could start, but still an oh crap moment. I doubt you'll get too many real stories. Mine is extremely rare, as I was the patient, but awake for the surgery. I was supposed to have a bump on my back removed. Nothing huge, just a lump of some kind. For insurance reasons they did it as an ambulatory in the OR of a hospital instead of the surgeon's actual office. So, I'm wide awake, face down in the OR. I had picked him as my surgeon because his main practice was plastic surgery. At the time I lifted weights a lot and spent a lot of time working my back. I wanted as small a scar as possible. I was vain. He begins with the first incision, then goes for a second, larger, then goes deeper, I guess, and realizes the bump is just the extruding tip of a cyst that cut through my back to the back of my lungs. He wasn't used to operating on alert patients. As soon as he realizes, he just says, "Oh frick." That was the beginning of a 4-hour surgery for which I was awake. What they cut out of me was the size of an adult fist. Enclosing the wound they drew in so much flesh, for lack of a better word because of my lack of medical understanding, that my right arm became essentially inflexible. I couldn't lift weights for years. All that precious work shot down the drain. What an butthole I was. As someone who has a small bump on my back that I've been putting off getting checked out, this story is terrifying. My first C-section was quite the shocker, but after that not a lot faced me anymore. This event occurred during one of my internships as a high schooler to see if medicine would be my field. Why? I'm not sure, but they let me attend a C-section. They placed me at the feet of the woman that was numb, chest down. I give her a little nod and the operation starts. Well, no one had thought to tell me that once the belly is cut, the liquids go out too. This is the logical thing. But I was seated at least 3 meters from the feet of said woman and the fluids gushing from her abdomen came all the way to my feet. Here is me, standing in a woman's pregnancy fluids. Oh, frick. I must have looked very shocked because the other surgeons had a laugh about my reaction. Ever since, I've not been shocked once. I dropped my phone in a puddle of amniotic fluid after I scrubbed out of a cesarean. I was rounding a few months back and a guy gets wheeled into ICU smelling terrible. I walked over, and the dude had maybe the most macerated legs I have ever seen. There were things moving on the bed, and the suction container was full of maggots. Turns out dude had been weaving on the road, and when police pulled him over and opened the doors, maggots fell onto the road. He got taken to the arrested, taken up to ICU and very rapidly debrided, then bilateral above knee amputated. He actually made it out of the hospital, but I cannot imagine waking up one day and having no legs. I really wish I knew where he was driving, though. The medical stuff really becomes a blur. Complications, bad outcomes, crazy patients, I dunno. But after a few years even the bad stuff just becomes part of the routine. But there was one moment that still sticks with me from training. I was called into a meeting with the program director, which is never a good thing, and I wasn't entirely sure why. He makes some small talk, then start asking about one of the junior residents who had been on my service. Definitely one of the weaker residents, but hardworking and likable. I start talking about her performance and her relationship with the other residents, her strengths and weaknesses, etc. After a minute I came to the horrible realization he wasn't just asking about her, he was gathering ammunition to fire her and I was part of the firing squad. I jammed on the brakes and tried to talk her up, talking about her work ethic and how well she got along with the nurses in the team. But we both knew it was a done deal before I sat down. I don't know why it bothered me so much, compared to kids who burn to death and the like. But that sudden realization while I was sitting there that someone I kinda liked personally, who had spent most of their adult life struggling in undergrad, medical school, and the lab, who had what I suspect was six-figure debt, was about to get their career destroyed just stunned me. I don't know if she was going to be an unsafe doctor. I think the fact we liked her allowed her to slide further than she should have, in retrospect. But of all the terrible things that happened in residency, that's the one I think about most often. Nurse here. I was assisting with a simple vasectomy and the doctor was having trouble differentiating the vas deferens from the testicular artery. I stopped him just before he cut the artery. If he cut that, the testicle would die, not to mention make a very bloody mess. Not a surgeon, but I was observing a hand surgery about a year ago at a teaching hospital. The surgeon was removing one of the carpals, the bones near the base of the hand, to be used later. A nurse was given the carpal to hold until it needed to be used. She ended up dropping the patient's bone on the ground. I broke my wrist once, and the broken bone had to be surgically adjusted so it would grow to be a nice and functioning one again. It appeared to be an easy and uncomplicated procedure, and 2 hours later I woke up with a cast around my arm being told everything went fine. A couple of weeks later I returned to the surgeon who performed the surgery to have the cast removed. As soon as he took it off he had a confused look on his face. I could see him think shit, and he told me perhaps it didn't go exactly as planned. The two parts of the bone weren't placed in a straight line during surgery, so after a couple of weeks in a cast my arm was now really funny looking and crooked. Arm had to be manually broken again and put in a bit more of a straight position. Few weeks and a wicked looking scar later everything was okay again. Not a surgeon, but I'm a med school student. A student 2 years older than me dropped a brain tumor on the floor on the first surgery he ever went on. The surgeon laughed at him, then told him to leave his operation room. He was devastated and never saw that surgeon again, but he still got a good evaluation for that rotation. At least it was a tumor and not something they planned on putting back in. When I was a medic, I worked in the one night and this huge dude, maybe 350 lbs, came in from a car accident with the paramedics giving him CPR. We got to doing our job when it was decided that he would have to go to the OR as he eventually went asystole, flatlined. I was new and my knowledge was pretty limited at the time, but I believe they were going to massage this guy's heart. I was pretty relieved since we were all taking turns pumping this big butt man's blood for him and we were beat. Shortly after he left I was talking to some of the medics docs and they said that it would be a great experience for me to watch it in the OR room. So I scrubbed up really quick and went in to watch in the back and they were already about to start cutting this guy open. I watched in excitement as they were cutting through everything when suddenly, blood burst out of this guy like a pot boiling over. There was more blood than I have ever seen, and hopefully will never see again. I don't remember anyone saying oh crap, but I remember everyone getting really quiet. The staff stepping back as the blood flowed out of him, on the table, falling on the floor and crept until it got a couple feet away from me. I was like 6-8 feet away. Most of them were standing in the lake of blood when it stopped. The surgeon said that it looked like at least 3 liters of blood that came out of him. They hadn't seen that much blood come out at once either. It looked like some kind of Japanese horror scene afterwards and I think I was in shock because I felt so weird and out of place afterwards, watching them so clean him back up. Later on, I ended up finding out that upon a closer look to the x-rays it showed that the man's poor sternum gave way either from his chest hitting the steering wheel, he had no seat belt on, the firefighters, paramedics or our CPR. The bone had splintered and punctured into his major vessels, aorta, pulmonary vein artery, so we were pumping blood into his pericardium, heart sac, and that was what exploded when they cut him open. So there was little we could do to save this man's life. After that episode I never was bothered by the sight of massive blood loss since I don't think you could see any more than that come out of a person. TLDR. Blood. So much blood. Oh. TL. DR. Wear your seatbelts. I was the patient, not the doctor, but the doctor in charge of the surgery I went through in 2008. 22 hours, 3 doctors and 55 units of blood. Said that if I'd been 5 years older and he'd seen what he did upon opening me up, he'd have closed me up, sent me home and told me to enjoy the rest of my time. It was sobering to eventually hear that. Since I'm guessing there aren't too many surgeons on Reddit during the middle of a Monday, I'll throw in what I have. Surgical nurse here. I was an OR nurse for a very short time in between 2 jobs in hospital surgical units taking care of post-op points. Right now I'm in a surgical step-down unit, which means really sick post-op points who aren't quite sick enough for the ICU, but could still start tanking any minute. Most of our oh crap moments are pretty boring, like oh crap, they found more cancer. Oh crap, his oxygen percentage is going down. Oh crap, there's a mucus plug obstructing her airway. Things like that. In the OR, the worst I saw was some shithead optometrist who thought spending 5 minutes per patient was a good way to do cataract surgeries. Most surgeons spend about 15-25 minutes per surgery. At one point he told me to keep the pre and post-op eye drops uncapped, because he didn't want to have to wait the literal 5 seconds it took me to unscrew the caps after each surgery. The patient's eyes looked all mangled and misshapen after the surgery, whereas every other cataract surgery I've ever seen, the points look fine right afterwards. Not really an oh crap moment, but I told my boss after that day that I never wanted to work with that guy again. It was an accident waiting to happen. I heard one of his patients got an infection and lost their eye, but most of them were fine. Still, I wouldn't have let him watch my goldfish for a week-long vacation, let alone come at my eye with a knife. He was a doucher nozzle. And this is how ophthalmologists got that reputation. My mom had gone in for surgery. Because the hospital didn't have what they needed, they had to have an essential part for the surgery shipped to them. The day comes for the surgery and my mom is prepped. The OR is prepped. The surgeon took the day off from his practice, and my mom is put under. The part they needed, a fluid I believe, arrived and a nurse said, "We never ordered that," and sent the guy away. This is after my mom was under anesthesia. She said when she was being brought out of it she could see the surgeon losing his crap on these nurses and all them crying from how bad he flipping out on them. Rightfully so. Those nurses at that hospital suck. The surgery was moved elsewhere and that was the last time he worked with that hospital. I wasn't the surgeon involved in the case, but a patient had a bump on his leg. After imaging, it looked like it was an abscess collection that needed drainage. The patient was taken to the OR and the subcutaneous tissue dissected off. All of a sudden blood starts squirting. Turns out the abscess was really a femoral artery aneurysm. Overhead stat called for the vascular surgeon to bail him out. Story from my vet. He was in a super rundown barn with a pregnant mare in trouble. She'd been getting up, lying down, and getting up again, but nothing was happening. Horse births are heck on earth. His words, because the foal doesn't turn until minutes before birth is supposed to happen. And if they're in the wrong position it's nothing in there but rigid legs and sharp little hooves and good luck getting that repositioned with 1,000 pounds of frightened horse flesh in pain on your arm. So there he is, at night, up to his elbow in this frightened mare. She's not really into what's going on and doesn't want to stand for it. He's not terribly fleet of foot in that position, so it's up to the owner at her head to keep her calm, and that person is doing the best she can. Keep in mind this barn is in horrible shape. Really, just a dilapidated health hazard. Well, the mare decided she'd had enough and tried to walk through the owner. I'm guessing there was a stud chain involved, a metal chain that loops around the nose, jaw, over the gums, or however you want to attach it so that you have more persuasive power over the horse. The owner was shoved off balance and managed to grab a live, uncovered wire. Why there was one in a barn I will never understand, but the result was that current flowed through her to the horse and into my vet. So now the poor guy is elbow deep in a terrified mare while both of them and the owner are being electrocuted. He didn't tell us how he got out of that, but the mare was okay and she delivered a live foal. They named the filly Electra, and that was when I first began to think maybe I didn't want to be a horse vet after all. Man, I thought this was going to end up with the arm being smashed by electrically induced cramping or something. Glad there was a happy ending there, but man that sounds pretty fricked up. Dr. Nick, Singing, the knee bone's connected to the something. The something's connected to the red thing. The red thing's connected to my wristwatch. Oh. If I kill you, you don't pay. Mine isn't as gruesome as some of these, but I figure I can share. I have several herniated discs, pinched nerve, spinal spondylosis, etc etc. Went in for a major epidural. Most people get one too, but I was getting 6. Basically, they put you under, fit a needle in between your discs and give you a shot. Well, it might have been due to the fact that I was taking some heavy dosages of narcotics already, but I woke up on the table. It was kind of hazy, but I was definitely aware. I could feel a slightly burning fuzzy feeling in my back. It felt like butterflies when your leg goes asleep and there is something scraping near on or on my bones feeling. I could see a screen with a live x-ray looking thing. I found out the surgeon watches the screen to guide the needle. Just as I could feel like I may be able to raise my head, I came to the realization one of the nurses kept repeating, "He's awake, not too panicky, but definitely, like oh crap." I wanted to tell her to relax, but by then someone walked up to one of the IVs and I was back to sleep. All in all, it was a win. I threw a fit about how good the fruit juice was, so they gave me the whole container, and I tried to fight the nurses trying to dress me, because my girlfriend was waiting outside on me. She thought it was cute, so she obliged and brought me to Wendy's per my request. I then ordered over $20 of food, got home, and ate none of it. Good times. This is less oh crap scary, and more oh crap. As a medical student, I got to assist in the repair of a vaginal anal fistula. Basically a connection between the two that meant the poor patient was leaking crap out of her vagina. Given the nature of the operation, the operating room smelled so horrific the anesthetist actually had to leave because they were dry heaving so much. Towards the end of the operation we had to flush out the remains of the colon, and so I flushed saline through whilst the consultant surgeon stood at the end of the table with a bin bag. Once we were done, the surgeon looked at me with a totally defeated look in his eyes, up to his elbows in crap, and said, "I have a really freaking glamorous job." So that is my oh crap moment. A shiny upvote to you for literalism. This happened to me while placing an IVC filter, a small metal filter that sits in the inferior vena cava to prevent blood clots from traveling from the legs to the lungs. The procedure basically includes tunneling into the femoral vein and traveling up into the vena cava where you leave the filter in place. In order to confirm your location in the body, you have to use a radiolucent contrast and an X-ray to light up the vena cava, since you are basically looking from outside of the body. The scrub tech hands us 100 cc of contrast and we inject it straight into the vena cava and watch on the X-ray while nothing lights up as it's supposed to. Not able to figure out why we couldn't see it, we ask for another 100 cc of contrast and again shoot it into the vena cava with no luck. At a loss as to what could be going on, we think maybe that the contrast is bad and we draw up some more and look at the syringe under the X-ray before injecting this time. Of course the syringe does not light up, and while we are trying to get some new contrast in the patient on the table who is sedated and intubated begins to seize. We finally look over at the scrub tech's table and realize what she has done, and turns out she was drawing up 100 cc, twice mind you, of lidocaine, a quick acting anesthetic which is not supposed to be injected directly into the central circulation of the body. Luckily the patient was not permanently harmed due to this medical error, but I was working with a very senior vascular surgeon at the time and I've never seen her look the slightest bit fazed by anything she's seen, but when she realized we gave the patient that much lidocaine she looked like she was about to faint. TLDR. Injected 200 cc of lidocaine straight into the heart thinking it was contrast and caused the patient to have a seizure. Serious, doctors, have you ever wanted to refuse a patient? What did she do? Yep. Currently discharging a patient for forging disability paperwork and faking my signature on the form. DHS. Dept of Human Services hilariously contacted my office requesting that I sign it myself rather than having the patient do it for me, as if she had my consent to commit fraud. Yeah, drug seekers who get really mean and nasty and in my face, yelling at me, insulting my intelligence and education, gawked out on who know what legal pills and illegal substances. Those people ruin my day. I add fuel to the fire by refusing to give them any more narcotics. I am a nurse at an allergy and immunology clinic. Since we are not an ER, we have the right to refuse patients. Most people are asked to leave simply because they are being buttholes to the staff. People can get really angry and abusive about their bills. In my time, I have seen maybe 5 patients terminated for their inappropriate behavior. More often, the most interesting folks we turn away are not even patients. For a long time, we had a nice homeless man who would come in at least once a week in a tattered fake UPS uniform and ask if we had any packages. We would always tell him we did not, and he would quietly take a fistful of lollipops from the front desk and leave. We eventually had to tip off the building manager as patients were complaining, but I think about him every so often. I truly hope that somewhere, someone is providing him with candy. I have seen maybe 5 patients terminated for their inappropriate behavior. Play nice, kids, or it's Dr. Jekyll's special injection brew. Drug seekers like the rest have said, but there was one that stood out in my memory. A lady who was triggered as green on a particularly busy night. Green is usually non-life-threatening things that can wait a few hours before being seen. Grew impatient after a few hours of waiting. She stormed into our work area, the door connecting us to the waiting room, and started yelling at everyone why she was still waiting. One of the nurses approached her to calm her down, and I remember hearing her yell this on the way out: "You're public servants. Remember the servant part." My shift ended before I had to see her. She should have remembered the patient part. I once fired a patient for being an incredible pain in the butt. Details escape me. Years later, after I had moved to a new location, she showed up to make an appointment not knowing I was there. New staff read her chart: "Do not ever appoint this person," and froze up with her in waiting room. They came to ask me what to do, but by the time I had gotten out there she was already being crazy and said very loudly, "I will never come to this place. You are all very rude," and left of her own accord. She basically fired herself the second time. I worked in a GP surgery for a while, and I know one of them has transferred at least 3 patients, 2 guys, 1 girl, for declaring their love for her. Also a couple of ridiculously violent people, usually pain pill seekers, get kicked out. Bear in mind this is in a dodgy area of Belfast and half the patients are former current paramilitary members, so violent means violent. Oh, that reminds me. A different doctor in the same surgery had his coat stolen by a patient, and one of the other patients, who was a paramilitary member, who really liked him, made sure he got it back with everything in it, minus money that had already been spent, and told him the thief patient would never bother him again. So I guess he had a patient refused on his behalf? I really wonder how often MDs get hit on. Like seriously hit on, not just flirted with. I mean, my gum surgeon is cute as heck, and my mom is also super into him. When my husband was in med school, they had fake clinical days where they hired patients to fill a role, dying terminal DX, and one who disrobed and went for it so they could practice how to handle those situations. I was a nurse at a walk-in clinic when we had a patient come in for a spider bite. She had a small swollen spot on her butt and was probably bitten by some common house spider. Definitely not venomous. She wanted a doctor to make it disappear so that she could work that night. She was a stripper and knew that she would make less money with a red swollen bump on her bum. The doctor couldn't do anything and the patient got angry and started getting loud. She yelled loud enough for the whole clinic to hear. Well, just suck it. She wanted the doctor to suck the venom from her butt. We immediately asked her to leave. After a few minutes of arguing, we had to call the police. TLDR. Stripper wanted a spider bite on her butt sucked. Homegirl needs to put a temporary glitter tattoo over that. GI doc here. Unfortunately, the patient had borderline personality disorder and would swallow razor blades every time she got into an argument with her boyfriend. She has had more than 30 upper endoscopies. Yes, people who yell at my staff for no reason at all. People who are clearly drug seekers. We had one guy at the VA who had been seen the previous 3 nights in a row for pain. I pulled his chart. I also pulled his chart from 4 previous VAs he has been to. All the same, I denied him. He then sent his wife in for back pain. I took one look and told her to leave. He then moved on to the next VA down the interstate. Some patients will obviously be difficult to care for, and there are plenty of other doctors in my area. A patient might call and insist on talking with me before making their initial appointment, then not let me off the phone with multiple questions. I'm generally busy, trying to get to the next patient. Worse, they will start to disagree with my over the phone answers. This has happened more than once, and I've said to them I'm sorry, but I can tell you would be better off with another physician. At that point, they always back down and talk about how they've heard how wonderful I am, etc. But I'll let them know they need to call somebody else. The first time this happened I'd been in practice only a short time and had lots of openings in my schedule, so I was very hesitant to do it, but I was very glad that I did, and realized I had control over my life and my practice. Resident physician. Never fired a patient, but a colleague with her own pediatric practice fires patients who are not immunized. If they won't follow her medical advice, go somewhere else. Good for her. I really dislike it when parents don't listen to the qualified medical advice of a medical doctor, especially in the case of vaccines. I am a psychologist but not a physician. I refuse to treat people all the time. However, by treatment I really mean assessment, as this is what I do, along with some counseling in select cases. I refuse to treat adolescent patients that do not agree to therapy. It's a waste of everyone's time. I also refuse to treat or assess if there is even a hint of an upcoming child custody hearing. Heck no. Ugh. I'm a teacher, you're smart to avoid child custody cases. Those get nasty, and no one ever wins, especially not the child. I had a patient come in so drunk she couldn't walk, wanting her crowns delivered. We didn't have them. She was rude, so all we did was resmont her temporary crowns. I had another who's an alcoholic and somehow lost her new denture that I delivered for another doctor. She called me a year later upset that she didn't know what she did with them between the time she left the office and got home. I really wanted to ask her if she called the bar she stopped at to see about the lost and found. I just told her we could make a new one for her if she paid. I had a doc discharge refuse me once. I was 16 and he was my neurologist for my epilepsy. I had only seen him a couple of times. My parents, divorced, were fighting over who would pay for my doctor visits, and so I wasn't able to see him as often as I was supposed to. He told me I was irresponsible and I should try harder. Dong. This is also the other side of the coin, but as a teen, in the 90s, I was particularly entrenched in the whole grunge punk look. I had terrible problems with ovarian cysts, and had ongoing medical treatment for it. At one point I was sent for an ultrasound, and the tech performing it started berating me, saying your pain is obviously from all of the scar tissue here from your abortion, and kept making comments of the like. I was 16, in pain, and was horrified by what this man was saying to me. I had never had an abortion. I realized later that he had made assumptions because of how I was dressed, and realized just how crappy people can be sometimes. Yeah, not all doctors are equal, not by a long shot. I am on the other side of this one. When I was in my 20s back in the 80s, I was working for a really crappy factory. I was unloading a truck and pulled a groin muscle, and at first it did not seem too bad and I just ignored it. One day it really flared up and I was kind of scared and hurting, so I went to a local clinic, and at admitting I was asked if it was work related and said yes, and the admitting lady stared at me as if I had two heads. I went in to see the doctor and told him what was wrong, and the butthole said you can't sue your company. You can go back to work tomorrow, and that was it. No explanation of what was wrong or any attempt at help, all delivered with a dismissive and contemptuous voice. At the time I was young and dumb and pretty used to being treated like crap at home and at work, so I just left and accepted that as my fate. I have matured a lot since then and don't take that crap anymore. Despite being thought of as having to do whatever the doc says, pharmacists have quite a bit of leeway in dispensing. I've had people refuse to leave, even when closing. People scream and swear and use racist comments. People crap on the floor of the bathroom, and just plain try to snatch it out of my hand. One went outside, got in his car, came through the drive-thru and asked if this was bulletproof glass. I had no idea but promptly answered yes. As a resident, and I feel that I speak on behalf of many of us out there, we cannot thank you enough for what you do. So many times a pharmacist has called me to double check an order and I am always thankful for the call. All too often it has resulted in improved dosing or takes into account something we hadn't thought of initially. So for your information, thanks and we love you guys. Nurse here. Known drug addict patient complaining of headache pain. I offered her Tylenol first and explained that if that didn't work we would offer her something stronger. She started screaming at the top of her lungs that she needed Dilaudid. Actually Dilaudid, but that is what she said. That pills did not work for her and the only thing that helped was Dilaudid. Then she fired me. I was certainly relieved. People with no real medical emergency who call 911 when they have multiple family members who could easily transport them. A lot of people assume that getting brought in an ambulance means you'll get bumped to the top of the waiting list in the air so they don't have to wait for ages. Of course they've no clue about triage nor the thinking skills to realize that the stabbing victims and heart attacks are always going to get treated over a broken bone. Often, in the ED or hospital you can't refuse them. Sometimes I give the appropriate care which is not equal to what they want. That is, narcotics, benzos, tons of tests. In the clinic, we fire a lot of people. 2 men in no-shows, fired. Cuss out the front desk and threaten them, fired. I had a patient come to see me today after being with another doc I know well. He wants more Oxycontin. The other doc only gives him $30 a month. He is suffering on that. I told him I would take care of him, but I wouldn't be writing for his chronic narcs. He won't be back. I won't take patients who refuse to vaccinate their children, unless they have a medical reason such as an allergy or severe reaction. Sort of related, my office phone number is very similar to a pain management clinic's. I had the lovely opportunity to answer the phone of a very pissed patient who was being refused service and could not understand that she called the wrong number. I could only imagine what the poor workers their experience with this woman. In the 5 conversations I'd had with her I was called a lying CB, she will find where I live her and have her ex-con boyfriend beat the ever-loving crap out of me and other various versions of threats of bodily harm and insults. This went on for a week straight before she realized that I wasn't playing a trick on her, that she actually called the wrong number. I was a manager at a GP surgery. I've kicked quite a few patients off our list, the majority for abusive, threatening or racist behavior towards my staff or attempting to defraud the practice. I did however refuse to have a patient attend the practice, insisting that he was only ever seen in his own home. He was a convicted pedophile who'd also been done for sexual assault on a girl the same age as 2 of my receptionists. He defecated and urinated in the clothes he stood up in, had probably not bathed since 1973, was permanently drunk, and on the one time he drove to the surgery, hit every wall, barrier and car in the car park. Luckily he was recalled to prison not long after he was assigned to us and was not alive for long after that, having refused treatment for sepsis. Wretched creature. Vet here. So clients rather than patients. I wouldn't say that I fire clients often, but it has certainly happened before and will probably happen again. Usually it's with people who refuse to comply because they read something online. People who routinely waste your time talking about internet diagnoses, both huge time drains, just not worth the trouble, and people who refuse to have their pets properly vaccinated, posing a danger to the rest of the patients. And of course people with a history of not paying for treatment. We get drug seekers on occasion, but those are presumably rarer than in human medicine. I just have a funny vision of a dog pointing his paw toward the medicine cabinet. You show him a bottle of Tylenol and he bats it away and heads for the oxy. All the time. I'm on my break on shift right now and we've already thrown out 2 tonight. Abusive idiots who don't understand they can't just F and blind and get what they want. Every day we throw patients out here because, at least when I'm in charge, you don't get to walk into my emergency department and shout and be abusive and horrible when there are poorly patients and kids who don't want to hear that. I don't care if you don't want to wait or if you fricked up your stupid foot being drunk. It could be busted to heck and back for all I care. If you're shouting and swearing in my face you can go away. More doctors need this attitude, I feel. Unless, you know, they had their liver lacerated by a punch. There was a guy in my hometown who was homeless and had a heart attack. Era gave him orange juice and had security throw him out when he wouldn't leave. Died on their lawn of guess what? Heart failure. I once went to a doctor with my 4x broken arm, which was apparent at 3 months before. The titan nails should be removed soon. Me and my mother waited a normal amount of time, but somehow my mom freaked the frick out, made a massive scene, causing the doctor to kick me and her out, refusing any future contact. Well done, mom. Okay, I can't hold back any longer. I was in a hospital bed, in the process of losing my baby. I had major complications from enlarged fibroids, when the queen of nurses accused me about lying about the severity of my pain. Her exact words were, "Nice try, honey. I hope that her crap life is freaking filled with misery and desperation. Yeah, can't you tell I'm just here for the drugs?" Whoa, I hope he reported that. See. My dad is a general surgeon. He can and does regularly refuse to see patients. Of course, he doesn't do this if they need immediate, life-saving surgery or anything, but he absolutely will for less time-sensitive problems if he doesn't think he is a good fit for them. I guess aside from the overtly abusive, violent, straight-up butthole patients, as a neurologist, the most frustrating ones I see on a regular basis are non-compliant seizure patients who also abuse alcohol and street drugs. They come in after being off their meds and going on and drinking binges, and of course they have seizures. And it's like, okay, I can pump them full of meds now, but ultimately what do you want me to do for this person? They leave the hospital, stop their meds, start drinking again, and the cycle repeats ad nauseam. Abuse my staff, you're out. A patient that didn't get what they want. Young lady, you work for me. My letter to the patient. Paraphrased, no, she works for me and your behavior has compromised the doctor-patient relationship, blah blah. I took my daughter to the pediatricians a while back. We were in the examining room waiting on the doctor's arrival. I received a call from my boss at work and answered because she hadn't arrived. The doctor opened the door, saw me on my phone, and rudely told me she'd return when I decided the appointment was more important than my phone call. If it hadn't been an on-base doctor, a major, I think, I would have responded in kind. Instead I bit my lip. I know I wasn't the doctor, but this one refused me for the time I was on my phone. But dang, work calls. My friend's crazy wife was refused treatment by several medical DRs. She has borderline personality disorder, and maybe because of this or not she is very rude and bitchy. When they examined and questioned her, she didn't like or agree with what they had to say, so she would storm out of their offices yelling and swearing. He had to take her to several DRs until they found one who told her what she wanted to hear. It's pretty normal to decline a ride in the ambulance when it's obvious it's not necessary. It's the doctor's decision. In my country, Czech Republic, people started to call an ambulance whenever something small occurred instead of going to the ER. Why? Because they would have to pay a fee of 90 crowns there. Yes, America, you pay literally thousands of dollars in care, and here people won't even pay $3.50. The Czechs didn't even want to pay 30 CZK, $1, for a GP, so the parliament abolished it. Funny, huh? I wish. I'm a nurse in a hospital, so we can't refuse patients. We had one patient who was only there a couple of days. Thank God. He threatened to sue us every day. Every single person who came in the room he berated and called them incompetent. On day shift alone he went through 2 different nurses who eventually refused to continue to take care of him after a few hours because he was so awful. My manager ended up being his nurse and basically never left the room. She cleaned the room with the housekeeper and was in the room when he ordered his food, and when the doctors visited him, he still called the dietary people idiots for bringing him the wrong food. It was exactly what he ordered. Threatened to sue the doctors for negligence, etc. At one point he was complaining that the hospital wasn't doing enough and the nurses weren't doing enough for him. My manager said she had been in the room all day and she said that they had been doing absolutely everything they could be doing. He said that it wasn't enough and they should be working harder to please him. He also constantly talked about how other hospitals in the area were way better and our hospital was a crap hole that only hired stupid buttholes. He was mean and derogatory, and I wish we could have just shipped him off to another one of the better hospitals. psychologist. Not being able to afford the $5 copay on the meds you need that keep you from spending $200 or more when the lack of meds puts you in a hospital. But you can buy premium gas for your car, expensive food for your cats, constantly hoard arts and crafts stuff at hundreds of dollars a month. Come back and see me when you display the prioritizing necessary to get your life in order. Otherwise, complete waste of time. Oof, I wish my meds had a $5 copay. I pay $300 more on my meds and currently have no income, but not getting them is not an option. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.